These they're
You
like,
showed me some.
yeah, they're like rubber calamari, really tough.
Yeah.
Really.
And then long.
Yeah. I mean, if you want me to go and get them, I can. Let me go and grab them quickly.
Yeah. So you've just gone off to get these are actual clots.
Yes, these came from the arteries and veins
Of real people.
of real people. So these, we had to flush these out and pull these out purely,
Maybe you can just hold one up.
to clear their circulatory system, to be able to pump fluid round in.
But they're like huge lengths.
Yes, yeah. So the longer and bigger the vessel, so what I found early on was I was finding them predominantly in people that had a full post-mortem, and the reason for that, obviously, is I can get right in there to have a look.
Yes,
You know,
yes.
so these ones are all very small, and the reason for that is
So
because
these are small.
these are tiny. Yeah, usually they're a lot bigger. They fill the vessel that they're in.
Yeah.
So this young lad, he's aorta, which is the vessel under the heart, was maybe 85% blocked, and in total we pulled about 200-300 grams out of him. And I contacted the coroner and said, "Listen, we've had this young lad in. I know you've done a post-mortem on him. We've found some really unnatural clotting inside him. Are you aware of it? What is it? We've never seen it before. Do you need samples?" And they wouldn't reply to the email.
Right.
But they rung me back. One of the office girls rung me back about 3-4 days later and said, "Oh, it's just about the clots that you said you found. Don't worry, you can discard them. We spoke to the pathologist. He said they're totally normal." Now I can tell you, I worked for the coroner for a number of years, 7 years. The Northants coroner. They're anything but normal. This shouldn't be floating about inside your arteries and veins. And now I started speaking about it straight away, and then I was finding they weren't releasing to me very quickly from the coroners. And then when they were coming in, they were all cleaned out. I couldn't find any. And all of these ones are ones that I've found from straight cases, ones that haven't been post-mortemed. And that's why they're so fine, because they're coming out of the carotid artery.
Right.
So the way that works is, with a straight case, as I went to before, we just do that one artery. So when you put a pipe in and you pump formaldehyde in, when you release that pipe from the artery, you get back pressure.
Yes.
And this is what's spat out on the table. So these are all from the small carotid artery. There'll be loads and loads that I've missed, and there'll be loads and loads that I suspect they're clearing out, because you're not a very complex creature. You know, that venous and arterial network, they'll be well practiced at clearing the evidence out.
So you're saying that is a direct result of people having the jab?
Yes, and every one of them has been vaccinated. How do I know? Because I asked the family at the point of arrangement, and if you cast your mind back, you're dangerous, you're selfish, you can't work, you can't travel. They were very keen, everyone should be jabbed.